Hello and welcome to this taster session called Understanding Hearing Impairment. It's been commissioned by the Education and Training Foundation and designed and delivered by Remploy. The aim of today's session is to develop your awareness of hearing impairment and its potential impact on learning in post-16 education, and to introduce further training, resources and support. Hearing impairment, hearing loss or deafness are terms that we are using to refer to someone who has some level of hearing loss. It's important to note that some people believe the term impairment has negative connotations, so may prefer the term hearing loss or deafness. The level of hearing loss can vary greatly. Hearing loss is usually measured by the quietest sounds that somebody can hear in decibels. The quietest sounds people with mild hearing loss can hear are between 20 and 40 decibels. This means they can't hear quiet background noises such as a ticking clock. Although their ability to have one-to-one conversations isn't really affected, they will struggle to pick up on every word when in a crowd or a noisy environment. People with moderate hearing loss can't hear sounds which are 41 to 70 decibels, which is the level of normal speech, a doorbell or a telephone ringing. With severe hearing loss, people can't hear sounds between 71 and 95 decibels, which is the equivalent to an alarm clock or a vehicle engine. This makes it extremely difficult for them to follow normal conversation without a hearing aid. And profound hearing loss is the most significant and severe loss of hearing, preventing people from hearing sounds quieter than 95 decibels, which is about the same level as loud machinery or music concerts. People with this degree of hearing loss can't hear conversations at all and usually rely on lip reading, gesture or other visual cues, and some will decide to use sign language. So what causes hearing impairment? There are two main types of hearing loss. Conductive hearing loss is when the sounds can't pass freely to the inner ear, caused by a blocked outer or middle ear, a ruptured eardrum, or an abnormally formed ear structure. Sensory neural hearing loss is caused by damage to the hair cells within the cochlea or the hearing nerve, or both. This damage is permanent and could be caused by natural aging, prolonged exposure to loud noises, some infections such as rubella, certain types of medication, genetic factors, complications at birth, head trauma, or a tumour. This type of hearing loss not only affects the volume of sounds, but also how clearly the person can hear them, making speech in particular an issue. According to Action for Hearing Loss, it's estimated that 1/6 of the UK population has hearing loss, which is more than 10 million people. Of those, 900,000 will have severe or profound hearing impairment. By 2031, this is predicted to increase to 14.5 million as the population ages. From the current total, around 6.4 million are of retirement age, about 3.7 million are of working age. There are more than 45,000 deaf children in the UK, half of whom are born deaf. The remainder develop hearing loss in childhood. Tinnitus is the term for the sensation of hearing sounds like whooshing, budging or humming in the absence of any external source of sound. It's a widespread condition. The British Tinnitus Association estimates that 10% of the UK population experience tinnitus frequently, 5% experience persistent or troublesome tinnitus, and up to 1% so that it impacts their quality of life. There are around 250,000 people who are classed as deaf-blind. One other interesting statistic to bear in mind is that on average, people take 10 years to address their hearing loss. Further education is the most common post-school destination for deaf young people. According to the Deaf Young People in Further Education report from Manchester University, based on 2011 figures, 60% of deaf young people will leave school and go into further education, compared to only around 1/3 of all young people aged 16. The statistics also reveal that although the vast majority of deaf young people complete their further education course, nearly 1/4 don't achieve any qualification at any level. The dropout rate for deaf students in further education is twice that of the general population. Around 1/3 of deaf students will follow a course at level 3. And of those who follow an AS level course, fewer than 4% will actually achieve the qualification when they have completed the course. The research also shows that deaf young people generally enter further education with fewer qualifications and lower levels of academic achievement in comparison with the general population of 16-year-olds. But the majority of deaf young people in further education don't make up this qualifications gap that they have on leaving school in comparison with other young people of their age. This means it's really important that further education staff understand the support needs of deaf learners so they can achieve the best outcomes possible. Entering further education is also a big change for learners, presenting both challenges and opportunities. There's a huge range of hearing technologies which have made it easier than ever for deaf young people to enter further education. Although this may go some way to addressing basic communication needs, there are other difficulties that deaf learners could experience that may not be immediately obvious to those who are working with them. Deafness will impact on a range of factors that contribute to a student's ability to learn, including listening skills, attention and concentration, language development and literary skills. It can also affect memory and processing, including impact on working memory, auditory memory and processing time. Other things affected include incidental learning, which is learning from experience and absorbing information from around you, learning style, which is how you learn best, social skills, including conversational skills and making new friends, and self-esteem and well-being. Being deaf from a young age or birth has a huge effect on an individual's ability to learn spoken language. This is because we learn language through both hearing and seeing. Without exposure to spoken or signed language at a young age, both literary skills and language development can be delayed and won't come as naturally as it does for others. People have mixed experiences of the education system, and they may miss out on information affecting their vocabulary, grammar usage, and literacy overall. For those who are born deaf, British Sign Language is likely to be their first language, with English as a second language. And BSL has a completely different grammar and syntax system. Hearing impaired individuals are therefore more likely to make grammatical errors and have difficulty reading complex sentences and formal documents. Most people pick up a lot of background information from just hearing it in passing. General knowledge is picked up from the media, casual conversations, and overhearing other people. All of these opportunities for incidental learning are dramatically reduced for deaf people. In particular, this can impact their ability to gather broad evidence in order to form and express opinions, which is often required in post-16 learning. There are a number of factors which can affect how language development is, including the age at which they became deaf, if their hearing loss was discovered, diagnosed and managed early, the support they receive from parents and professionals, their underlying cognitive ability, their personality characteristics such as determination and confidence, and how well hearing technology works and if it's used consistently. Advances in hearing technology screening and testing does mean that many more people are able to use spoken language, but this doesn't mean that they don't have any other language or literacy needs. Deaf people may find it hard to converse with their peers if they don't know how to communicate with deaf people. If they use lip reading, individual conversations can be managed, but groups may be much more difficult. Possibly through lack of opportunity to socialise, they may not have developed good social skills or the confidence to speak to others. And with limited incidental learning, they may not have picked up on the unwritten rules of social situations and conversations either. This can mean that deaf individuals become isolated and socialise mainly with other deaf people or family members. This can present an additional challenge educationally too, as they may struggle with pairs and group work. An Action on Hearing Loss report in 2013 found considerable evidence that those with hearing loss are more likely to experience mental health issues. The impact of losing your hearing can be traumatic for people, leading to grief, anger, and anxiety. Not only do they experience the loss of a sense, they also have to find new ways of communicating, and there can be a worry over losing independence too. They can lose the ability to socialise with friends and family and become isolated, and some people deliberately isolate themselves to avoid awkward situations around communication. Some people feel their options become limited both in education and employment, feeling that they won't be given opportunities or responsibilities, and their confidence can take a massive hit as well. Listening and attention. So, if your hearing is limited, it takes a lot more effort to listen and understand, especially in a group or noisy environment. Hearing impaired people report increased concentration, effort, attention, and focus compared to individuals without hearing loss. The brain must work harder to make sense of the information that it receives. 3 areas of our brain which work with our auditory system to process and produce sounds. When there's hearing loss, The extra work required to listen, concentrate and think makes it much more difficult for these areas to work well together. This makes communication harder and takes a lot more effort. The increased tiredness that's caused by this is called listening fatigue. This is likely to occur even with a mild hearing loss and may not even be noticed by the individual themselves. British Sign Language, or BSL, is the predominant sign language used in the UK and is classed as a separate language. It has a very different grammar and structure from English. For example, in a sentence, you start with the subject or topic and then refer back to it. BSL interpreters take many years to qualify and different levels are required for different activities. Signers qualify at levels 1, 2 and 3 and 6 before registering as trainee interpreters. It's good practice to use a qualified interpreter for an official meeting, but a communication support worker who's qualified at a lower level can be used to support other activities. All of us, whether hearing or otherwise, use some degree of lip reading when we're trying to understand what other people are saying. However, some people who have hearing impairments rely on lip reading rather than using British Sign Language. The way we form our words can lead to confusion for the person who's lip reading. Therefore, the lip reader depends heavily on environmental cues and understanding the context of the conversation. Group discussions can be difficult for somebody who's lip reading, especially when multiple people are talking in quick succession. The challenge here is to know where to look. And if somebody uses an unusual tone or rhythm of speech, this can also be difficult. A cochlear implant is a surgically implanted electronic device which gives a sense of sound to some people with severe hearing loss. Hearing aids that don't give people perfect hearing, but are designed to make speech and everyday sounds louder and clearer. And many types now also reduce certain dull background noise, as well as making it easier for people to hear the sound they're focusing on, leading to less straining to hear. Hearing loop systems isolate the sound heard within the confines of the loop, helping to reduce the impact of background noise. Somebody wearing a hearing aid can link with the loop by turning their hearing aid to a certain setting. There are 3 main types of hearing loop system: room loops, counter loops, and portable loops. Conversation listeners work by making sounds picked up by a microphone louder and clearer to hear, as well as reducing background noise. A hearing dog is an assistance dog which is trained to help people who are deaf or hearing impaired by alerting their handler to a variety of sounds. You can find out much more about these types of equipment on the talk course, Hearing Impairment Awareness, which follows on from this taster session. Hearing loss can vary greatly and can be caused by a range of different things, and of course each person is impacted differently too. The key to offering the right support is to find out how the individual is affected and what can help them. Think about how profound their hearing loss is, what they're able to hear, if anything at all. How long have they been hearing impaired? How do they prefer to communicate? What aids and adaptations do they use? And what support are they receiving? A more formal assessment of what support they require may be needed too, to provide all of those who are working with them an accurate account of the learner's needs and strengths, so adjustments can be planned and implemented to help the learner progress. A good assessment will include information from school, college or previous training providers on attainment and also previous adjustments, the views of parents and professionals, the results of any specialist assessments, identification of the need for access to technology and communication support, and what support will be needed to meet any specific course requirements. And also, we should include the learner and find out what they think. Many deaf people embrace their deafness and are proud of their history, and there is a very strong sense of community and culture amongst deaf people. The deaf community, spelt with a capital D, is predominantly made up of deaf people and those with hearing loss, their friends and family members, but also community workers and some professionals. In most large towns or cities, there will be a local deaf club where people meet together socially and take part in social, leisure and sports activities. It's a good idea to make sure that you're aware of these clubs and also any other local organisations that can support deaf people, such as Action on Hearing Loss, British Deaf Association, Royal Association for Deaf People, National Deaf Children's Society, Tinnitus UK, Hearing Link or Deaf Plus. Our Hearing Impairment Awareness course explores the signs, symptoms, behaviours and impacts of hearing impairment for learners. It helps you to increase your knowledge and confidence to embed the skills effectively into the support that you're providing. We look at the condition and how you may adapt your communication, teaching strategies and environment to enable your learners to achieve their full potential. The course is designed for anybody working in educational training with young people who want to develop their knowledge and good practice around hearing impairment. This could be practitioners and managers from further education sector, training skills or apprenticeships providers, and indeed anybody who's working with young people transitioning from education into work. By the end of this training, you'll be able to describe the potential impact of hearing impairments on learning in post-16 education, outline how an individual's language learning and literacy can be affected by hearing impairment, explain how to alter your communication to make it more effective for individuals with a hearing impairment, identify at least 5 strategies for adapting your training to suit individuals with a hearing impairment, summarise the main benefits of the technology, equipment and support staff that can be provided, list the key ways you can ensure good acoustics for a learning environment, define the potential impact of hearing impairment on well-being and the support you and others can provide, and explain how you can support hearing impaired individuals to progress into further education and employment. And you'll also be able to build and make use of a reference guide to develop what you've learned further. There are 4 talk courses: the 23rd of October in Birmingham, 20th of November in Leeds, 29th of January in London, and the 19th of February in Manchester. You can book onto the courses using the link on the page or email training@renfrew.co.uk. In the meantime, you can find out more useful resources on hearing impairment and other disabilities and their impact on training and education on the ETF website. On the Excellent Gateway site, you can search and browse for over 7,000 expert resources throughout the education and training sector, or search using filter using the Discover Resources tab. Here you can find briefing papers and case studies as well. You can also join the Society for Education and Training, which is the membership body dedicated to professionals working across further education, vocational training and teaching. It is the largest membership body in the education sector, aiming to help you to progress your career, inspire you to be an even better teacher or trainer, and connect you with thousands of like-minded professionals and experts. On the ETF Foundation Learning Online, you will find online learning programs to support you in improving organisational performance and learning delivery. These programs will also contribute to your continuing professional development. You can self-register and create your own login. Once you're logged in, to enrol on the program, select the category you're interested in, and it will reveal what is available. Choose your desired program, and then you'll be prompted to enrol. Thank you so much for taking the time to join us on our taster session today, and we look forward for you to join us on future taster sessions and on our talk courses. Thank you very much.